Morning. How is everyone today? It's been a while since my last Facebook Live, and I apologize. Things have been rather hectic, and that's all good because busy is good when you are running a business. And we're less than 10 days away from the holidays. I don't know if you're ready, but if you are, please don't tell me because I am totally not ready yet. And I don't know if you saw my post, we'll be closed over the holidays from December 23rd and until January 1st. I'll be back in the office January 2nd to help you with all of your oral health needs. But this week, please stop in. I've got some really fun sales on some of my oral health products. 40% off activated charcoal, and there's some awesome stocking stuffer opportunities. So pop in, I'll be here. But what I'm hopping on live to talk about is kids' dental care and are your children high risk? And we'll talk about what can make a child high risk for cavities and how to know if your child is high risk. And then we want to talk about all of the things that we can do for a child who is high risk. Just knowing that a basic checkup and a basic cleaning is probably not enough for that child, and some things that we can do outside of that, and basically the philosophy in matching the care to that person's needs. So particularly here in Windsor, Essex, I don't know if you've heard, but tooth decay it's at a crisis. We've got kids experiencing cavities under the age of 3, under the age of 5, under the age of 2. I regularly see kids with demineralized areas on their teeth. And there's lots of things that contribute to kids getting cavities. Diet is a big factor. Nutritional status is a big factor. What was going on during gestation or pregnancy is a huge factor. Your dental history, if you experienced a lot of tooth decay, if your spouse experienced a lot of tooth decay, your children can be higher risk for decay. Other things that can contribute to risk factors for decay as a child is their medical history. So if a child has acid reflux, if a child has digestive issues, if they have allergies, have frequent congestion, sinus issues, and tend to breathe through their mouth as opposed to their nose, they're going to be higher risk for decay. Preferences in their diet is huge. Carbs, refined sugars, all of those things can contribute. We want to make sure that their diet is very whole and very healthy and avoid things that are refined and processed. Lack of water, dehydration can make a child high risk for decay. But if your child is under the age of 5 and has experienced a cavity, I would classify them right away as moderate to high risk, because baby teeth shouldn't have cavities in them, and we can do lots to support the health of those teeth. And basically, the way our system is set up, quite often kids are getting their care every 6, 9, 12 months, but things change so quickly with kids. So, they can have a dietary preference where they completely, stop drinking their water, or they've chosen a snack that is promoting tooth decay. They can be someone who tends to have more of the bacteria that causes cavities, go through a period of time where they're unwell and they have a lot of sinus congestion. So if your dental professional is in a position to identify that, we can help support you going through those times. And that's basically what we want to do. When you see your dental professional, someone needs to be talking to you about all of the risk factors. So that's diet, and that's habits, and that's lifestyle, and that's preferences, what you're using in the home environment to support health, and how we can make little modifications that are going to help promote that child's best interests, which is lowering their risk of disease, lowering the incidence of tooth decay, so that they don't need to have many fillings or any fillings, which is always my goal. And some of the things that we can do professionally, so is increase the frequency of how often we're seeing them. So if we see a child and we know that, they don't like to brush, their diet is not perfect and we're working on it, their water intake is not perfect, or they have medical issues that are contributing to decay, any of those factors, we're going to want to see them more often. So tightening up the interval, so whether that's 3 months, 4 months, 5 months, that's going to depend on how high the risks are. That way we can watch and we can make changes to any recommendations we've made as changes occur in the oral environment. We can see early decay. 6 months, 9 months, 12 months, remineralizing treatments are not effective. There's very little therapeutic benefit in having an in-office remineralizing treatment, which is fluoride, hydroxyapatite, all of the things that are available to us professionally. Having it every 6, 9, 12 months, very limited benefit. It can support healthy teeth. It's not going to reverse or remineralize, which it could do if we're doing it more often. So again, having the remineralizing varnish on a interval that's actually effective at reversing. The other thing is dietary counseling. So talking to you about, changes that have happened in the diet that we might want to make little modifications to, acidity. There's all kinds of things in the diet that can contribute to making sure that we're eating or drinking things that can promote decay at the same time we're having meals. Those are all conversations we'll have at that time. But tightening that frequency so that we can watch, increasing the frequency of the remineralizing applications, working through how are you doing your hygiene depending on the child, making suggestions on how we can motivate your child, and get them involved depending on their age. So sometimes it's just a matter of, with a little person, is getting them on a surface where they're safe so that we can do the hygiene for them. So that's brushing, that's flossing, that's applying something that has a bioavailable mineral to strengthen and protect. Again, that's another thing that we need to do as a professional, is make sure that everything you're using at home is what's matching that child's needs at that time. So basically, we need to know better. Instead of just a checkup or just an examination, we need to match the care to the child's needs, and that is what we work at doing every single time we see somebody. So medical issues, again, there's all kinds of things that we can do in the home environment that are going to contribute to a healthier mouth. And if we know the risk factors and we're matching the care to their needs, then we're going to offset and get ahead of the decay process and help stabilize it, control bacteria. So there's all kinds of things we would talk about, like xylitol, like hydroxyapatite, like water intake, like detergent diets. And kids who are high risk need most of those things, if not all. So if you have questions, if you have a child and you want to know, is my kid high risk? What can I be doing for them to help ensure that they're not experiencing cavities going forward, that we're controlling bacteria? How should what should their diet look like in a day? We're here to answer those questions. So, consultation is completely free of charge if you just want to come in and talk about your child. If you want to look at having your preventative care here, kids under the age of 3 are free for their first visit, because if we miss that crucial time where the whole decay process and risk factors are getting set up, then we're looking at trying to reverse a bunch of areas of disease, undo habits that are set. And it's really hard with a toddler to tell them, you've been doing this regularly. Well, now we can't do it anymore. We're going to take it away. So if we set things up from the get-go that are health promoting and make changes and support your child as they grow, then we're not going to experience that, having to sedate a child and take teeth out and stainless steel crowns and all these things that are awful and set you up for a lifetime of trauma. So if you have any questions about anything, a question about a product, shoot me a picture. I would love to help you and let you know if it's health promoting. There's a lot of things on the counter that, they have a lot of bells and whistles or claims that they really have no benefit unless they're used in a certain way. I can help guide you there. Just call our office, 519-736-1100. I'd love to help you and your little ones. You can visit the website, embracedentalhygiene.com, or follow the Facebook page, because I'll try and do as many lives as possible. But just know that the care that you're receiving should match your needs. And that's a discussion that you need to have with your dental care provider. If your child we need to do more than brushing and flossing. Those are just one aspect of oral care, and everything else that is, in our life our lifestyle is what's either going to promote disease. And if you were high risk, you can work at from a proactive standpoint. If you were high risk as a child, if you're high risk now, you can pass that bacteria to your child. So you want to make sure you're limiting sharing things like utensils, cleaning off soothers, kissing them on the mouth. Those are things that we want to limit because you're going to pass the decay causing bacteria to them. And then we can set them up knowing that you are high risk, look at them as moderate risk right away and help prevent them from developing problems. Then we make changes as we go on. And then the healthier, more balanced the oral environment are, the longer between visits we can go unless there's a change or a new issue. So anyways, this went way long-winded, but basically make sure that the care that you're getting matches your needs and that you're doing everything that you can in order to protect your child from decay, and know that there are no bad teeth. There are no bad teeth. It's the environment that the teeth live in, and it's either going to promote disease or it's going to promote illness or promote wellness. So we can help ensure that environment is promoting wellness for your child. Anyways, thanks so much for watching. Get in touch, comment if you have questions. I'd love to hear from you. And happy holidays. I don't know if I'm going to get to do another live before we're done for the season. And all the best from my family to yours. Thanks so much. Bye now.